Have you ever felt exhausted despite sleeping all day? It might be a sign that your body is missing a critical survival hormone. Today, we explore Addison's disease, also known as adrenal insufficiency. This condition occurs when your adrenal glands fail to produce sufficient levels of cortisol and aldosterone. Cortisol is essential for managing stress and regulating blood pressure. When these levels drop too low, the body struggles to maintain energy and fluid balance. Symptoms often develop slowly over time, which is why many people only recognize the disease after a sudden illness or injury causes them to worsen rapidly. This slow progression makes diagnosis difficult. However, the ups and downs of untreated Addison's disease are life-threatening due to the body's inability to handle stress. To understand the severity, compare it to Cushing's syndrome, which is caused by too much cortisol. Here, we see how a single hormone imbalance dictates survival. The most critical takeaway is that low cortisol stems from a failure of the adrenal glands to make enough steroid hormones needed for daily life. Understanding these hormonal mechanisms is vital for survival. If you know someone affected by this condition, learn more about treatments and resources to support them.